You know, it's often the case that when we talk about counseling, therapy, whatever the word is you want to use, it's often stereotyped into what this little cartoon displays, which is kind of funny because it's, you know, it's trying to take a poke at Henry VIII, who the minute he got upset with one of his wives, he'd just simply have their heads lopped off. And what a therapist often will do is reinterpret in terms of how somebody's feeling, and that's the stereotypical caricature, if you will, of a counselor is, so how do you really feel kind of thing. I moved to this one, although we're still going to talk a little bit about psychodynamic and psychoanalytic therapy. And again, as we were talking about analytic and then psychodynamic, as we were talking about back in theories of personality, there are major orientations to personality, and they usually follow or actually precede the therapy model itself. And just to do a short review with you, psychoanalysis was developed by Sigmund Freud, and it was his therapeutic approach. Some of the key things that he would emphasize are free association. He would often, that couch that was in the previous video, he would sit at their head and they would simply talk looking into space in a sense. They'd just hear his voice behind them. Another one would be resistance and resistances. In that context, we often talk about transference and countertransference, and this occurs. Transference actually is a cornerstone of some of the change in psychoanalytic thought, and countertransference is where a client, let's see if I can get this in, a client raises issues or raises reactions. I'm going to put it on the second line here, it's easier to see. Raises reactions in the therapist because of whatever issue they tend to talk about. And the reality is that we're human, and even as therapists, we're human, and so we're going to have people talking about things that are very close to some of our own issues and our own stuff. So transference and countertransference, this is the means by which the change occurs. Freud essentially, and I'm going to write this again just to make a point here, Freud would often look at transference as the vehicle of change, and essentially it was what we now call in psychodynamic thought the Therapeutic Alliance, and that is part of the backdrop of what you hear in psychoanalytic or psychodynamic therapeutic alliance. That's what oftentimes you hear in psychodynamic. If you're talking to a therapist, they make a big deal out of the Therapeutic Alliance, and it's true all the way across. The reality is we just use different words. Another element that is in here is interpretation. Generally, the therapist makes it their job to interpret life events and life decisions. The client, in this case patient, are not necessarily the ones that are responsible to make sense of their life. The therapist is seen as the person to do that. And then we also have the release, otherwise known as catharsis, of repressed feelings, which is really, in a sense, the point of therapy from a psychoanalytic, psychodynamic point of view. And then ultimately, gain self-insight is the other element that is part of the psychodynamic point of view. They are really, really big on insight. Now, the presumption, of course, is, and I think it probably could be challenged, excuse me, is the idea that insight leads to change, and I think you could probably make a case that would argue that that's not necessarily the case. I've met a lot of people who have a great deal of insight into the things that are going on inside of them, but they do absolutely nothing really to change any of that. So resistance, the other aspect, and let me just add something down here to the whole idea of resistance, is that essentially resistance is a blocking from awareness of anxiety-laden material. And that's something that sometimes is called resistance of anxiety. Oops. Laden material or memories might be a better way to put it. And essentially, from a psychodynamic point of view, the therapist's job really is to try to get through these resistances by following using transference. The client transfers their feelings and so forth to certain people in their past to the therapist in the present, and working through those to gain some insight into their relationships with people, and that is where catharsis occurs and presumably healing occurs. Now the second thing that I want to broaden this term dynamic. Broaden this term for you a little bit, and is that psychoanalytic point of view has really kind of fallen on bad times and into obscurity, but it's been picked up in what we now call psychodynamic therapists. And basically they try to understand current symptoms by exploring childhood experiences and the therapist-client relationship. So their focus is still very similar, except that they're not doing the classic psychoanalytic point of view, but they are looking back into history, exploring these experiences, and then secondly, the therapist and client relationship, what is happening in it, to help the client gain insight to make the changes that they need to make. So those are two key points in psychodynamic thought. There are a lot of Christians, it's not antithetical to our faith, there are a lot of Christians that are psychodynamic in their orientation. It is not antagonistic to the faith, although Freud certainly was. And they assume, in a sense, that the history back here in childhood is the thing that set up the problem in the present, and therefore it's worth going there. The thing to keep in mind is our history certainly does contribute to who we are today. The question is just because I know what it is, does it mean that I'm going to change? And there's a huge temptation here, sometimes just to find a person to blame rather than making the necessary changes. Now, there are a lot of psychodynamic therapists that would absolutely reject the notion that they're looking for someone to blame. But that being said, it's still part of the backdrop of what we're talking about here. There are many of them that will resist that notion and never go there. Their presumption, again, as it is in psychoanalytic thought, is that insight leads to change. And as I said a minute ago, I have real And I think a lot of people do, not just me. I have real questions about whether that's a natural progression. A lot of times this area, this little arrow here, really defines what the power of the relationship between the therapist and the client, and in the context of that relationship is where change actually occurs.